Hello friends, it's been some time since we've done one of our videos, but we wanted to do another one. My name is Keith Carson, Director of Partnerships for Therapy Specialists. I'm joined with Kelly Cooney, VP of Compliance and Training, and Lisa Rodriguez, VP of Clinical Operations. And we want to talk to you today at a topic that's on everybody's mind, and that's the patient-driven payment model, which is going to be coming out in October 1st of 2019. More specifically, we wanted to talk about the interdisciplinary team. Today, it's surprisingly a topic that has not been discussed much in the conversation about PDPM. And specifically, we wanted to talk about the importance of the IDT under PDPM and how the IDT is ultimately going to change. Its role is going to be a little bit different than it is right now. So, Lisa, if you could share with us maybe your thoughts on the importance of that team under PDPM.
Sure, I'd love to. So I think to really be a highly functioning IDT under PDPM, we need to work as a team and not come in and just represent each other. So I think that is one thing that I know we're focusing some training on, is how to get our customers IDT to be a little bit less about themselves individually and more collaborative. I think it's going to be extremely important for them to be successful. I know you have a couple of ideas of what that would look like related to the MDS.
Yeah, absolutely. So right now, for example, the social worker might be the one that does the sections of the MDS that have to do with cognition and depression. So they may be the ones out there talking to the patient and getting to know whether the patient has depression or any signs and symptoms of cognitive impairment. And right now, for example, our therapists may have little interaction with that part of the MDS or how that's scored. And under PDPM, it's going to be really important that all of us know about that, how that person did on that depression scale and how they did in terms of their cognition, how they scored, because both of those are going to be pretty big drivers of payment, but are also going to be a predictor or a barrier to progress. And so under PDPM, us getting that patient not just better and out, but with a better outcome also matters. For value-based payment and PDPM. So we really want to make sure that we're kind of bumping into each other's bubble a little bit going forward and really learning, okay, social worker, what did you find when you did that? And I think we're finding that when we look at some things, that some folks, maybe we have some social workers or nurses that don't really understand some of those tools and so maybe aren't using them to their best capacity and could really use some additional training and collaboration to make sure we're capturing that well.
I also think the role of the therapist is going to evolve quite a bit. Right now, a therapist comes into the IDT and talks about the evaluation they did, this morning or yesterday, and they're going to be on PT and OT 5 times a week for ABC and speech, 3 times a week. And I think going forward to the IDT, the therapists need to be a lot more articulate. They need to bring the value of therapy into that conversation. They need to talk about this person is very similar to what we had last week, the same characteristics with that gentleman who was very successful. The program that we have put together with therapy is that that person is going to achieve the outcome that we want them to have, right? So PT needs to be 5 times a week. They scored an 18 out of 28 on the Tenetti. We really need to get them to about a 20-21. And I know that with services of Therax and Gate that we're going to be successful. They have to be able to come in and really explain why they need the services, because it's not about minutes anymore. It's about what that patient needs based on the characteristics.
And Kelly, would you touch on maybe some of the training that we're doing specifically that is going to support the efforts of the IDT?
Sure, absolutely. Well, one of the things we're really looking at is how the team throughout the plan of care looks at discharge planning. That's another interdisciplinary process, right? Everybody shouldn't be working in their little bubbles. And so it's a great launch pad for all of this PDPM discussion, is really having everybody talking about the patient the whole time, about how we're getting them where they want to go. So that's one of the areas that we're really working on. I think I know also that Section GG is a big piece of PDPM. It drives the therapy component it drives PT and OT components, it drives nursing. And so making sure we get good at GG. And so that's training with our therapists and the facility team together to say, how do we all get good at this and really drive those outcomes for that resident.
Great point, because up until now, section GG, we really were, it's a usual performance, right? And so therapy was participating, but not quite as much as we see them needing to do under PDPM. One of the items is a car transfer. Nursing's not out there doing car transfer, so we'll be doing car transfer. We'll be doing that on the evaluation if able, and being able to deliver that in the IDT meeting. Just an example of something.
So a question for you both as we bring things to a conclusion. What is one specific thing you would want our viewers to take away from this video and incorporate into their preparations for PDPM, specifically as it relates to the IDT?
I would say just taking a look at your interdisciplinary team. We all have strengths and weaknesses within our interdisciplinary team, and now's the time to kind of identify who those folks you think are going to be able to take and go along with you and your team into this new payment model. And if the folks that are sitting around that table, if there's a couple of them that you're concerned about, can this person do this? Now's the time to be thinking about that before it's going to impact your payment and your patients negatively.
I agree with Kelly. I think an assessment of what's going on today is very important. I think as an end in mind kind of person, we're going to want that team to bring their information to the meeting that they don't bring now. You don't have MDS talking about anything MDS related in an IDT meeting, so we really need to start to have an expectation that MDS will come in and talk about the scores of certain items that we've identified as a team that we want to monitor.
Yeah, absolutely.
Well, we trust that you'll walk away with at least one thing from our video that will be helpful to you as you begin to prepare your IDT for what they will look like and how they will operate underneath PDPM. Thank you.